Let's do this. Let's play clip number 8. This is important. This is wonky, but this is important. This is a good, I would say this is a good preset for how to get really specific on with candidates as they run for office. And we already see this, of course. We saw the catastrophic talk with Nancy Pelosi's policy advisor undermining Medicare for all. Then we saw the terrible move by the Pod Save guy trying to make it a generic thing versus a specific thing. Abdul Al-Sayed, obviously, we very enthusiastically supported his run for governor of Michigan. He ran a good campaign. Unfortunately, came up short, but this is a very young, very talented guy who is going to keep contributing for quite some time, and he's doing it right now. Here he is on Rebel Headquarters, the TYT show, explaining the difference between the Center for American Progress's proposal on Medicare Extra versus single-payer universal health care.
How popular Medicare for all is. It's polling 60 to 70% depending upon the poll that you're looking at. And a lot of folks who are cozy with the insurance industry are thinking, well, how can we have our cake and eat it too? How can we make sure that these health insurers that, by the way, are big donors to Democratic and Republican campaigns, how do we keep them happy? And so they're taking the name Medicare for all and they're putting extra stuff in it. One plan that's pushed forward by the Center for American Progress is called Medicare Extra for all. And you'd think that if it's Medicare Extra, it'd be better than Medicare, right? Because it's extra. That's not the case at all. What it does, in effect, is brings back the idea of the public option. If you think back to the time when we were debating the Affordable Care Act, there was a question about the public option and ended up getting stripped. The Obama administration couldn't push that through. What Medicare Extra for all is in effect a public option. It allows you to buy into Medicare if you're a company or if you're an individual. Here's the problem, though, that keeps us with Medicare for some, because, of course, some people aren't going to be able to afford it. The big problem we have in our society right now is that Medicaid covers folks who make up to 133% of poverty, which is not very much at all. And then after that, there's this big donut hole between when the people can actually have access because they can afford healthcare on the exchanges. And then, of course, there's Medicare for people over the age of 65. Medicare Extra is not going to really solve that problem. All it does is introduce a competitive, publicly funded or publicly subsidized public option. And that's not enough. We need to make sure that anything that we call Medicare for all implies that it covers everybody. You shouldn't have to buy in. You shouldn't have to worry about whether or not your employer got it. You shouldn't have to worry about how much money you make or whether or not you can afford it. Right now, we know Medicare for all is so popular because people get the basic idea. It's Medicare for everybody. Medicare Extra won't be Medicare for everybody. It'll be, like you said, Medicare for some. And it's not going to deliver on the promise of Medicare for all. So there's a real political challenge there. And like you said, look, the reason Medicare for all matters so much is because it breaks the kind of collusion power that big insurance has with big healthcare. And if we just had another private system or Medicare for some, it's not going to do that. So we're not going to get the major cost savings. We're going to miss out on being able to provide healthcare for everybody.
So that's exactly right. That's well put. And it's something to have a lot of precision about when you talk to candidates. I mean, we've seen, obviously, the two famous examples so far. Kamala Harris had an excellent answer at the CNN town hall on Medicare for all about private. Let's move past it. Let's go. We got to get this done. The next day, she reversed herself. Cory Booker came out, said he supports Medicare for all, because, of course, he's a co-sponsor of Bernie's bill in the Senate, which would lead to real Medicare for all. But then the next day, his team clarified, no, he does not want to get rid of private insurance. It needs to happen. And not only does it need to happen, the actual further reaches of the conversation is what next part of the healthcare sector becomes public, so that pharma, as an example, which just privately sort of accesses and absorbs public commons. Most innovation in medical research is publicly funded and delivered, and then pharma profits off of it almost essentially as intellectual property and marketing companies. We need to stop that too and put healthcare in democracy's hands across the board.
There's some very simple facts that anytime someone who's talking about dismantling this industry that you can just point to and prove that it's been a failure and that it needs to be seriously reformed. None of this like kowtowing BS. So 62% of bankruptcies are due to medical debt. 70% of those people with that debt have insurance.
Yep.
That is astounding.
Yep. Done.
And also 1 in 3 fundraisers on GoFundMe are for medical debt. That's not a functioning system.
We need single payer universal health care. The case is overwhelmingly moral, and I want to make it on those terms. It's also, if you want to go there, it is the obvious, indisputed. I mean, there are both social, political, historical, but also bureaucratic and logistical reasons why every single other industrialized country has some version of this to greater or lesser degrees, and that the ones that perform best are more and more public.
And the Chapo guys made a good point on this, talking about the Johns. If you're already hedging on what your plan is and your politics, you're not in the room yet. You can't act like you're in the room, because that's what we did in 2016 and lost because there was no driving message behind Hillary Clinton's candidacy.
You're not in the room, you're on the trail.